suffer from a laundry list of medical conditions, from severe arthritis to a crippling terminal disease called pseudohypoparathyroidism. And I got to thinking about some stuff, and that's when I approached you. And we spoke about what we could do for me, because, you know, right now I have no options. Well, there is an option that our president could make available to me.
I first heard about that in 1959, talking to my father, who was a pharmacist. And he said, you know, when I was a freshman at the University of Minnesota School of Pharmacy in 1928, one of our assignments was to make tincture of cannabis. He said we had to be very careful because the alcohol was illegal. You know, in 1937, when they had the Marijuana Tax Act hearings, the AMA said, we're against this, and don't call it marijuana, call it cannabis. Nobody knows what you're talking about. At that time, cannabis had been in the United States Pharmacopoeia since 1854. The DEA's chief administrative law judge in 1988, in a rescheduling hearing, where he said, reschedule marijuana, the same as the California Medical Association just said a few weeks ago. And in his finding of facts, Judge Francis Young said cannabis is one of the safest therapeutic agents known to man. What have these scientists discovered? That CBD, cannabidiol, is neuroprotective. I mean, they have done studies with people that have put on heart-lung bypass machines and clearly demonstrates its neuroprotectivity in human beings. Tonya has an extremely good chance of having many, many more years of cognitive thinking and a productive life if she uses cannabis on a regular basis.
Now, isn't the CBD that you're talking about and Marinol, which is what somebody's going to come out of the woodwork and say, they already make a marijuana pill for Tonya.
The California Narcotics Officers Association and the federal agents like to say, we already have prescription marijuana, and that's Marinol. And that's only true if you believe that a single compound, THC, is equal to the plant that has 483 compounds, of which more than 65 are cannabinoids. The plant is more effective, certainly, than THC by itself. And by the way, Marinol or dronabinol contains no cannabidiol, the CBD, the neuroprotective chemical that we're talking about. And who patented CBD? The Department of Health and Human Services. And what did they say in their patent? This is neuroprotective.
And that antioxidant.
Exactly. CBD is an anti-cancer drug.
We have law enforcement, we have doctors, both with their hands tied.
Right now, the Drug Enforcement Administration is attacking medical marijuana dispensaries across this country. And what happens with that is that the thousands of patients, like you, Tonya, who have been buying quality medical marijuana from these dispensaries are now forced to go out into the criminal marketplace because they've already experienced the benefits. They've seen the benefits that are so much better than what's on the market from our pharmaceutical companies in many different ways. So they've seen those benefits, know that they need this medicine. So they're going to go out into the criminal marketplace, which is dangerous, number one. And number two, they have no idea of what they are buying. From your medical seat, what would you say to President Obama regarding our conversation here today?
You just heard from the California Medical Association. In 2009, you heard from the American Medical Association. This stuff needs to be rescheduled. It needs to be looked at as like any other therapeutic agent. And there are literally thousands of Tonya Davises out there.
Millions.
And they need the help that you can make happen in an instant.
And President Obama, from my seat of 33 years in law enforcement, What I ask of you is to help me to remove people like Tonya, wonderful, hurting people like Tonya, from the battlefield. Help me remove them from the criminal environment, allowing them to get the medical marijuana, their medicine that they need from responsible dispensaries with high quality medicine. Help me to defund criminal enterprise. Help me to get the guns off of the street by removing the dollars from these criminal gangs. Help me save my comrades. By defunding criminal enterprise. But most important, people who are suffering like Tonya will get the help that they need. President Obama, we implore you, we ask you today for your help. We ask you for your help.
We do.
Hey, people need to recognize that this is a therapeutic substance that's been around for 5,000 years, and it only was not a medicine from 1942 until 1996.
My law enforcement in the town I live are very tolerant. Most of those believe that they shouldn't have to go around arresting folks they think a lot like you. I believe with all my heart I deserve every opportunity. Now imagine if this was you and you had really bad health condition and they told you were going to die or whatever. Wouldn't you want to have every opportunity and access to anything that would help whatever's been proven to help?
It's unconscionable, it's immoral to deny Tonya Davis and people like her access to the medical use of marijuana.